Hey guys, welcome to Bharti Yoga. I'm Bharti. So, back pain is one of the most common problems faced during pregnancy. As your baby grows, your center of gravity changes and your pelvic tends to tilt forward, causing the lower back to overextend, which can cause lower back pain. In addition to that, in the last trimester, the relaxin hormone also kicks in, which starts relaxing and softening the ligaments in the pelvic joint, which add to the trouble of lower back pain. So today we'll be doing some stretches that will help in relieving this lower back pain. In addition to that, you must also ensure that you're maintaining a good posture, especially while sitting and standing in the last trimester, so that you can prevent this pain from getting worse. So once you are ready, let's hop onto the mat and get going.
We will start with an easy side stretch. Come to a cross-legged position. Straighten your spine and roll your shoulders back. Bring your hands on either sides. As you inhale, extend the left arm up. As you exhale, bend to the right. Look up towards the ceiling. Come back and bring your arm down. Now inhale and take the right arm up. Exhale, bend to the left. Come back. Let's do 2 more on each sides. Inhale, left arm up. Exhale, bend. Come back. Inhale, right arm up. Exhale, bend. Come back. Inhale, left arm up. Exhale, bend to the right. Come back. Inhale, right arm up. Exhale, bend to the left. And come back. Next, come to a tabletop position with wrists below the shoulders and knees below the hips. Try to maintain a neutral spine by pulling your belly in. Look forward. Take a deep breath in. As you exhale, curl your spine and hug your baby in and look towards your navel. Focus on rounding and stretching the back. Then inhale and come back to neutral. Exhale, curl down. Let's do a few more of these. Inhale up. Exhale, curl down. Inhale up. Exhale, curl down. Last one. Inhale up. Exhale, curl down. Then staying in this position, tilt your left hip to bring it towards the left armpit, making a C on the left side. Then release and do this on the right side. And release. Let's do a few more of these side-to-side stretches. Keep breathing and feel the stretch along the sides of the torso. And we are done. Come back to neutral. Widen your knees and push your hips back to come to child's pose. Here, try to get your hips to touch the heels and feel the stretch in the lower back. You can place a pillow below your forehead if your head is not able to reach the floor. Stay here and relax for a few breaths. Slowly come up. Next, lie down on your back. Bend your knees and bring your feet to the floor. In this neutral position, a natural curve of your spine will lift the lower back slightly off the floor. Take a deep breath in And as you exhale, gently rock your hips towards your head and press your lower back into the floor. Stay here for a few breaths. 5, 4, 3, 2, 1. And then release and return to neutral. Let's do 4 more of these. Take a deep breath in. As you exhale, press the lower back into the floor. Come back. Inhale. Exhale, press down. And come back. Inhale. Exhale, press down. And come back. Last one, inhale. Exhale, press down. And come back. Next, staying in this position, we'll do the bridge pose. Take a deep breath in. As you exhale, press the lower back into the floor and then start lifting your hips up to come to bridge pose. Stay here for a few breaths. Slowly come down, bringing your upper back down, then middle, then lower, and finally the hips. Let's do 2 more. Inhale, exhale, press into the floor and raise the hips up. Make sure that your knees stay parallel to each other and are not falling out. Slowly come back down, 1 vertebrae at a time. Last time, inhale, exhale, press the lower back down and slowly raise the hips up. Come down and relax. Next, come to a seated position with your legs extended forward. Straighten your back, taking the support of your hands. Then bend your right knee and bring the right foot near the left knee. As you inhale, take the right arm up and bring the right elbow on the inside of the right knee. As you exhale, gently twist to the left. Keep breathing. Slowly come back and repeat it on the other side. Bend the left knee. Inhale, bring the left elbow on the inside of the left knee. Exhale, twist to the right. Stay here for a few breaths. Make sure that your spine is long and straight. Slowly come back. Next, spread both your legs out in front as wide as possible without too much discomfort. Straighten your back and get your sitting bones grounded. Then place both your hands in front of you and start walking your hands forward. Stay as high or as low as comfortable. Here, try to make sure that your spine is straight and your chest is open and you're not slumping forward. Keep your feet flexed. Slowly come back up. Finally, come to a tabletop position. Bring the right foot near the left hand and extend the left leg straight back. Try to keep your hips level. There will be a tendency to tilt towards the right hip. To avoid this, you can place a pillow or a rolled blanket under the left thigh to maintain your center and keep the hips level. Then, keeping your spine long, you can walk your hands forward and bring your elbows down to the floor if that is comfortable. If not, you can just stay on your hands and keep taking few deep breaths to feel the stretch on the outside of the right thigh and in the front of the left thigh. Slowly release and let's repeat it on the other side. Bring the left leg forward and extend the right leg back. You can adjust the left foot forward to intensify the stretch. You can stay here or bring the elbows down. Breathe into the stretch. Slowly release and come back to sitting position. Hope you found this session useful. You can do these stretches on a daily basis to relieve or prevent back pain issues during pregnancy. That's all for today. I'll see you next time. Bye-bye.